I want to quickly shift focus to the other developing story that we're tracking very closely, because monkeypox has been judged a global health emergency. What I've done is I'm going to cut across to two of our best health hacks on India Today. Milan Sharma and Sneha Murdani join us on the moot question: do we really need a vaccine in India for monkeypox? Over to both of them.
So the question that everyone is seeking an answer to right now is whether there is a vaccine against monkeypox and whether the Indian government plans to inoculate the population against monkeypox, given that cases have increased in India. The government of India says right now it is not required, even as many experts are talking about and calling for the revival of the smallpox vaccination program, given that the smallpox vaccine gives protection against monkeypox as well. But the government says that this infection, monkeypox, isn't as transmissible. Just yet, no plan yet for vaccination, but even when they do not expect a COVID-19 like mass vaccination program across the country. The strategy will be very different. We'll talk about that in a bit from now, but what are pharmaceutical companies really saying? Are they waiting for an opportunity to manufacture vaccines against monkeypox? Milan, there have been conversations about pharmaceutical companies as well. Give us a lowdown on what these conversations have been about.
Yes, definitely, Sneha. In fact, the companies like Serum Institute of India, CEO Adar Poonawalla has already said that they could be in talks with the Bavarian Nordic, a company in Denmark that makes vaccines against monkeypox, but they would be looking at procurement of the vaccine, because it will be easier at this point since it would take a few months, and Adar Poonawalla has hinted that if there's a commercial tie-up, it would be better than to start making this vaccine from scratch, which would perhaps take a year or so. But they'd also look at how this particular emergency for monkeypox spread progresses, because there are hardly any cases in India at the moment. Yes, there are a lot of cases in the United Kingdom as well as in Europe, but there the vaccine stocks are existing. But in India, sadly, after the eradication of smallpox somewhere, India had stopped stockpiling of the smallpox vaccine. So perhaps they would require a strategy to start stockpiling them again in the meanwhile. But certainly, Sneha, even as the government is saying that they do not need mass vaccination for this, is ring vaccination the strategy to go forward for monkeypox?
We have an idea about who the vulnerable population really are. This is the LGBTQ community. These are men having sex with men. So the idea is, and the advice is, that those people around this knit, essentially this knit of people, close knit, be vaccinated. Also, it is advised in the case of monkeypox that if you know that you have come in contact with the monkeypox patient, and if at all that is a close physical prolonged contact, it is advisable to take this vaccination within 4 days of this of your coming in touch with this person. But like I said, right now this is not applicable to us in India. There is no vaccine being used in India just yet. But this exactly is the ring vaccination strategy that experts are talking about.